Welcome back. Well, as if you didn't know by all the mail, the phone calls, the texts, the commercials, Medicare's annual enrollment period has begun. It started on Saturday. So joining us with the best way to navigate all the moving parts of finding the perfect plan for you is Nikki Johnson. She's with FHK Insurance. Good to see you again, Nikki.
Good to be here. Thanks for having me.
I know. I love it when you guys are here. I just mentioned it started on Saturday. So it's all the annual enrollment plan is here. And those are for 2023 plans, right?
Correct. Yep. So AEP officially kicked off. We can now take applications for a January 1st start date, and that goes until December 7th. And we're seeing all kinds of crazy things in the market. So it's a very exciting time.
Oh, in a good way. So you guys are really busy already, right?
Yes.
Even just being Saturday, the start. I mean, it's like Monday.
Yeah. Well, I know. And I feel like we've been getting ready and like kind of ramping up for AEP since October 1st. So lots of training, lots of navigating all the plans, but a really high focus on those shiny points and the extras that are out there.
See, and I like that. And that sounds good to people. So what are you seeing in the market for this this annual enrollment period, the AEP?
AEP. What I'm seeing a lot of robust benefits. So even more dental, even more vision, even more over-the-counter items, in-home transportation, all kinds of shiny points that are out there. And you know, we all know that Medicare Advantage plans cover your doctor visits, they cover your hospital stays, they'll cover your prescriptions. But now, when we're evaluating plans, it's like, oh, do you need more dental? Do you need more vision? What suits you the best?
All right. See, I like that. And I feel like explaining a little bit of that more in depth has, you know, helps people. And people can sit down with you and talk about all those things as well. But those are really some big things that you mentioned, seeing all that extra coverage. Some of them even have like insulin savings right now, right? For $0?
Well, close, almost.
Okay.
So with the insulin savings program, they are limiting the cost of certain insulin. So not every insulin, which can be a little confusing too, because you hear insulin savings, you think, oh, okay, that's me. So some are going to be $35, and that's going to be locked in the entire year.
Wow.
So it's really going to save over the course of the year for your out-of-pocket costs, which is great. And now vaccines are starting to go down to $0 as well. So shingle shot, there's no out-of-pocket cost.
Wow. See, I think all of those things, like those specifics that people need in their life, because those expenses can add up. I think about it with my mom too. I just like, you know, because I've always told you she wears hearing aids, things like that are covered, or cataract surgery, things like that, you know, that people have to do.
Exactly. And, you know, hearing aids, those are not covered by original Medicare.
Right.
So you're going to have that built in with your Medicare Advantage plan. And people that have a Medicare supplemental plan, so a big premium plan, they're not going to have access to that. So a lot of people now are evaluating, okay, do I need to stay on my Medicare supplement, or am I better off looking at Medicare Advantage? And now is the time to do it, because you can save thousands and thousands. It's incredible.
Well, that's what people want too. They want more money. We all need more money in our pocket right now with inflation, everything. I think seniors are feeling it even more than most people because of the fixed incomes. And when it comes to those Advantage plans, there's like 33 this year, right? I mean, that's a jump.
Huge. Oh yeah. So there's 33 Medicare Advantage plans, over 20 prescription plans. So when you try to navigate all of those plans on your own, it's confusing.
Yeah.
So we do it every single day, and that's kind of the best part with FHK. You know, we take the time to listen to our clients and really understand what they need and what's important to them, and then figure out, okay, what's a good plan for you? What's going to fit your needs the best? And then also educate you year round. And the best part is we are here all the time. When you work with someone from a call center, you're not going to have them if you have a question, but you work with FHK, you have me, you have my entire team.
You know who she
Here
is.
you go.
This is Nikki.
Yep, exactly. So, I mean, it really gives people that peace of mind, and that's really what we want to do, because one size fits all health insurance is gone. Those days do not exist anymore.
Amen.
So it's so individualized. So it's really important to think about what works for you and not what works for a family member or friend. It's all about you.
Well, that's one of the things I love about when you're here, Nikki, is because I feel like obviously FHK trains advisors really well, but it's so clear in the way that you talk about things. You have these best practices that you guys really pay attention to with the education, like you said, just listening, being trained in all the available plans specifically, and then truly finding that best situation for your clients. That's a really big, important point for you guys.
It is, and we are trained so well that Bill wants us to read the Medicare and You book from front to back. And I thought, I don't have time to do that right now, but I'll work on it. I'll try. But I do know most of the information that's in the Medicare and You book. So when clients get that big giant book that's this thick, you better believe I will be reading that from front to back.
I have to know it all. Like, don't do it.
Right? I get a hall pass for that? Can I like just not do it?
I think so. So that's what people are going to say. You've got all this training. You've got
Yes.
all those things that you offer. What does it cost to work with you?
That's the best part. Our services are completely free. So you have my expertise year round, no cost to you, which is great. I have a great team behind me too. So if you need a new card ordered or you have an issue with a claim or service benefit, it's all taken care of in-house. So we can help. Yeah.
We're pretty much out of time. Is there anything else that you want to touch on or let people know?
Yeah, one quick thing, if you received a WEA cancellation, we're still working with that, so that was scary. But I think the scariest thing is do not give your Medicare number out to someone that you don't know. This time of year, you're going to be bombarded by phone calls, mailers. If you don't know that person, you've never seen that person, do not give your card number out because that will cause a plan change, and you don't want that.
Nope. Yep. That is not what you want. So here's the detail for FHK. Thank you so much, Nikki.
Yes, thank you.
It's good to see you. FHK Insurance is a local independent agency representing all the plans. To connect with an experienced advisor like Nikki, just call her. It's 414-228-7555, or you can go online to fhkinsurance.com.